how to communicate with people with dementia. So the goals for our discussion today, I want to talk about the impacts of dementia on the brain and on a person's way of being in the world. And so some of these include their person's processing speed, their memory, their relationship with reality, impulse control, which is sometimes leads to inappropriate behaviors. And then the real thrust of this is, how do I adjust my communication skills to support the changes that are happening in the brain of the person whom I'm caring for? So first, about the reduction in processing speed. Well, processing speed goes down, is reduced as we age. That's just sort of like the way things happen. You know, I noticed that in my family, everybody does Wordle, and then we share our scores, and, or not Wordle, rather, we do that too, but the New York Times, the little mini crossword that should take like, 2 minutes or less. And I'll post my scores and say, I got it in 1 minute and 37 seconds today, beat that. And my son is like 12 seconds. And it's because his brain just operates more quickly than my brain does. Because we naturally lose some brain tissue as we get older. We are always building more neurons, but we also are losing some. So in the brain of a person who's living with dementia, the brain is losing tissue because neurons are dying, neuronal pathways are becoming corrupted. The brain of a person who has dementia at the end of their life can be up to 1/3 smaller than the brain of a person who didn't have dementia. So that's a lot of tissue loss. And so what's happening at a very sort of simplistic level, if we think about when I'm looking at something, I have visual input. My whole brain is involved in that. There is information flying around from neuron to neuron to neuron as I'm processing visual images. So in the brain of a person with dementia, that data will pass from neuron to neuron, and oh no, that neuron is no longer there. Okay, I need to do a reroute. So I'm going to go this way, but that neuronal bridge is gone. So I need to find another way to go. The brain isn't going to give up. The brain is going to try and solve the problem of translating what the eye has taken in, but it's going to take longer for it to do that because there is so much damage in the brain. So this results in a slowdown in my ability to process what it is that I'm seeing. And of course, the same thing is true for things that I'm taking in through my ears and for my output. My ability to speak, to process a thought and get it out is going to be slowed down. So what we know is that a person who is living with dementia, before they're even noticeably symptomatic, is already starting to miss words in a sequence that's being spoken to them. So they could be missing 1 in every 4 or 5 words of a sentence that's being spoken to them. They don't realize that they're missing the words, but what's happening is it's becoming harder and harder to understand what is being said. And so the person starts to feel a little bit like less than. I'm not able to quite keep up. I'm finding that conversations about especially complex topics are getting harder for me. So one of the things that I noticed, for instance, is that when my husband and I would be in a social setting, this is pre-diagnosis, in a social setting where he had once been very gregarious, chatting with everybody, he started to withdraw because conversations were getting harder. He started more and more to slip off into a corner with his phone and just kind of isolate himself. So this results in, as I say here, the inability to keep up, this sort of feeling like I'm not quite there with everybody else. So how do I adjust to this impaired processing speed? Well, I start using fewer words when I communicate with a person. Instead of saying, hey, I have a really good idea, why don't we go to the restaurant now? I might just say, let's go to the restaurant. And I'm also going to slow down my speech. I don't want to do this ridiculously, but I do want to be conscious of the fact that the person is having a harder time processing sentences. So I'm going to keep them short and I'm going to slow them down. I'm also going to recognize that it can take a person living with dementia up to 20 seconds to answer a fairly easy question. So something like, are you ready for lunch? Could take up to 20 seconds. Now, 20 seconds doesn't sound like a long time, but it is. So, are you ready for lunch? So there's 5 seconds. By 6 seconds, I am going to be repeating the question and elevating my voice because I'm assuming that they're not paying attention or that they didn't hear me. When what I really should be doing as a care partner is slowing down and giving them the time to answer. It's really helpful to continue making eye contact if that's something that is comfortable for both you and the person that you're supporting. And it can be helpful to repeat a person's name. Hey, Mary, let's go upstairs now. Mary, it's time to brush hair. Is that okay with you, Mary? Because when I say your name, it brings you back into the conversation. Nonverbal cues can be really helpful. So Teepa Snow, who I mentioned earlier, who is one of my dementia heroes, and I highly recommend her work to everybody who is a family caregiver. She has tons of videos on TikTok. She's got a great website. She recommends a 3-step process when we're communicating, which is visual, verbal, touch, in that order. Visual, verbal, touch. So in other words, if we're getting to ready to brush hair, for instance, what I might do is first hold up the hairbrush. There's the visual. And I might show me brushing I might brush my own hair. There's my visual. Verbal, let's brush hair. Touch, may I? And now I reach out and I help you brush your hair. We want to limit distractions when we're having communication, like the middle of, Safeway or Trader Joe's or whatever is not really the place to try and have a conversation with a person with dementia, because now that we know about the fact that visual and auditory processing are impaired, imagine what it's like when you have all of this stuff coming in and you're trying to sort it all out and it's all taking longer than it should. And now your partner is talking to you and is expecting you to answer a question, but whoa, it can just make anxiety go up through the roof. So if we are in a busy place and we need to communicate with a person with dementia, best to find a quiet space within that. This past weekend, I was up in Victoria, BC, and my sister and I went to a shoe store at 11 o'clock in the morning, and it was very, very quiet, and it was somewhat dark, and it was sort of relaxing. And I thought, wow, this is sort of it feels like the power is not working or something. And one of the salespeople came up to me and he said, thank you for shopping during our quiet hours. We'll just be over here. If there's anything that you need, please help us. So there is this movement where store owners are recognizing that there are some people who, for a host of reasons, are better off in a less sensorily busy spot. And so they're actually trying to reduce those distractions to make it easier for people to be in their space, which I think is just amazing. And I applaud that. Avoiding open-ended questions. So when I say, what would you like to eat today? That's a big question because my gosh, there are so many choices. And so it can start to cause anxiety to go up for the person with dementia. And so what I recommend is instead, would you like a ham sandwich or a tuna sandwich? Or better yet, if I can show, if I have 2 cans of soup, do you want the pea soup or do you want the tomato soup? To really limit the choices so that they don't have to struggle to find an answer. And I'm just going to say this because it's something that, gosh, I see all the time, especially when there is somebody who's living in long-term care, that their family visits, when their family visits, that they will ask questions like, who am I? Hey, dad, who am I? Mama, which one am I? Which is just cruel. The better thing to do always when we engage with a person with dementia is to introduce ourselves. Hey, dad, it's me, Allyson, so that we don't cause them to feel like a failure, right? We don't want to set people up for failure. So another thing that happens during dementia is impaired memory, which is not true for all dementias, which is why it's so hard to get a diagnosis if you have a form of dementia that doesn't have memory involvement. So my husband, as I mentioned, had frontotemporal dementia, no memory issues there. He was able to, years into his diagnosis, recognize people he hadn't seen in a long time. When driving, I would say, man, I can't remember which way I turn here. And though he was nonverbal, he would point the direction. He was absolutely able to still tap into both long and short-term memories. However, probably like maybe 70%, 60 to 70% of people with dementia have Alzheimer's disease, and Alzheimer's disease does involve memory impairment. And that's because it hammers a part of the brain called the hippocampus, which is where short-term memories are stored and processed. So therefore, lots of people who are dementia caregivers are supporting people who have memory issues. And their oldest memories are the ones that remain the strongest. And so what does this result in? Lots of repetition. So repetition of questions. So there I am, I'm sitting at my desk, my mom is living with us, I have got to get this work done, and my mom pops up and she says, what time are we eating dinner? And I tell her, 6 o'clock, Mom, dinner's at 6. And she says, okay, because I just have the thing I need to, and I just need to know what time we're eating dinner. And I say, 6 o'clock, Mom. And it goes on. It is really, really hard as a caregiver to not lose your cool when that kind of repetitive questioning is happening. So we'll talk in a minute about strategies, but it's so important that we remember that there's nothing willful going on, that the person is doing the best that they can. But if you can imagine that this information, 6 o'clock, Mom, is trying to find a place to stay in the brain, but the place where it should be stored doesn't exist anymore. So there is no way to retain that memory, physically impossible. So of course, this can also result in things like missed obligations and confused reality. So how do I adjust to these memory changes? Preface everything with a big breath, right? I take a big breath. I remind people gently, because I'm not going to get anywhere if I scold them. It's just never, it's not going to work for either of us. Take the blame. So what I mean by this is, imagine a scenario where I am supporting my sister and I have made a dental appointment for her. And I told her 2 weeks ago that we're going to go to the dentist on this particular day at this time. A week ahead of time, I reminded her. The day before, I reminded her, I'll be at your house at 11 to pick you up to go to the dentist because I know she's got some memory issues. I show up at 11 o'clock, she's in her pajamas, she's watching TV, and I say, what are you doing? We're supposed to be going to the dentist. And she says, if you had wanted me to go to the dentist, maybe you should have told me that you want me to go to the dentist. And I could go to that place of, but I did tell you, I told you 3 times. Not going to get us anywhere. So instead, what I do, take a big breath and I say, wow, I am so sorry. I thought I told you, but I guess I didn't. So tell you what, we do have a dental appointment. So let's go ahead and how can I best help you get ready for that? So probably what I should do if I'm supporting a person with dementia is build extra time into all of our plans. I don't want to go to this place of, don't you remember? Well, no, they have dementia. They don't remember. They've lost the ability to remember. I saw this with my mom a lot. She would get very, very frustrated with my stepdad, who with his vascular dementia did have memory impairment. And she was constantly saying, don't you remember I told you that? That's not where the dishes go. Don't you remember I showed you this? Mom, he doesn't remember. And all you're doing is making him feel really, really bad about himself, especially with the, how many times do I need to tell you? How about 1 million? Is 1 million enough times? He doesn't remember. Do not make him feel bad. So we look for strategies, things like whiteboards, little notes. I see lots of people who have a little notebook on a chain, or people who have a notebook that they keep in their pocket, a little side bag that they carry where they write their notes down, or a whiteboard. That in that case, I would keep a whiteboard next to me while I'm working at my desk, and I would write down, dinner is at 6 o'clock. So when Mom comes in, I can just point to the board. Remove triggers. So let's just say, for instance, that that we're going to be going to a birthday party. And so I have the package, the birthday gift wrapped up sitting by the door. And every time mom walks by that package, it reminds her that, wow, there's a package. We must be going to a party. Are we going to a party today? Yes. I've told you 38 times. At 4 o'clock, we're going to Jennifer's birthday party. Get rid of the present. And sharing on an as needed basis. One of the questions that people ask a lot is this idea of being truthful. Like, you know, I know that my sister really hates going to the dentist, but I feel like it's really important for her to be prepared and for her to know that we're going to the dentist. So therefore, if the dentist appointment is on Saturday, do you think that telling her on Monday gives her enough time to prepare for the dentist appointment on Saturday? And my response would be, nope. If she doesn't like going to the dentist, then you're giving her a full week to live in a state of anxiety about going to the dentist. Maybe better would be Saturday morning that you say we're going to the dentist, or you do something like, what does she love to do? Maybe if she really loves going to this particular coffee shop, that morning you go to the coffee shop, you enjoy yourselves, everybody's in a good mood. And then after the coffee shop, you say, oh my goodness, it's almost time to go to the dentist. And she'll get irritated with me and I will take the blame. But what I have done is I have saved her hours and hours of anxiety. A little bit about reality. Because people's sense of reality changes when they have dementia. Misperceptions versus hallucinations. So hallucinations are sensory experiences with something that isn't there. I see, hear, taste, smell, even feel something that is not actually there. Hallucinations are not a common part of dementia unless the person has Lewy body dementia. With Lewy body dementia, they are fairly common, especially early in the disease. They tend to go away as the disease progresses. The hallucinations with Lewy body dementia tend to be small animals and small people. Like that's a really common thing that people would see with Lewy body dementia. So if my loved one is saying, watch out, you might step on the little people, which is an experience I've had when supporting somebody with Lewy body dementia. I don't, so I say stay in their reality. I don't say to the person, you know what, you're actually seeing things, there are no little people, unless that's the way my relationship is with them. If my relationship is such that they believe me, that they trust me implicitly, and they will believe me when I say that, and they're looking to me for that kind of honesty, then I would say that. Otherwise, my tendency would be to say, thank you for letting me know. I'm sorry that I don't see them, but I will be careful and you let me know if I'm about to get in trouble. I just really want to honor the fact that what they see is actually what they see when they are having hallucinations. Versus misperceptions. So misperceptions are much more common with dementia, and they are more likely to, when I actually do see, hear, smell, taste, feel something, and I misinterpret what it is. So I'll give you an example of this. And by the way, just one last thing about hallucinations. It's not just with Lewy body dementia. An infection can cause hallucinations. Lack of oxygen deprivation can cause hallucinations. So if somebody is hallucinating, we absolutely want to talk to a doctor about that. So misperceptions versus hallucinations, and I wanted to give you an example of that. So one of the things that I do is I facilitate a support group for spouses of people with dementia. And one of the ladies in the support group shared a story with us one day. She said, oh my gosh, my husband is accusing me of having an affair. And he says that he has seen me with the guy. He says, I see you with the guy. I see you doing things with him. And I'm telling you, I don't like it. And she's like, first of all, when would I have time? Because I'm with you all the time. And I love you. I'm not having an affair. But he wouldn't hear it. He was convinced that he had seen her having an affair with another, that he'd seen her with another guy. So she brought this to the group and she said, what do you think? And we were all like, oh my God, he's having hallucinations. You need to get him to a doctor, need to figure out what's going on. The next time that we saw her, she shared another story about something that had happened. And in this case, they were in a room together in their living room. And he stood up and he said, I don't know why you keep inviting all these people. I'm telling you, I don't like it. I don't like it one bit. Make them leave, make them leave. And so again, she shared this with us and we were like, wow, his hallucinations. Yeah, he's seeing all kinds of people. The next time that we saw her, she had another data point. And she said, you know, I've noticed that every time he goes into the bathroom, he always turns off the light before he goes into the bathroom. What is that about? So I asked him, why do you keep turning off the light? And he said, because I don't like that old guy watching me pee. And so, of course, it wasn't a hallucination. It was a misperception. The old guy that he was seeing was himself in the mirror, because he didn't recognize that as being himself, because in his reality, he was a much younger man. And so he would turn off the light so that old man couldn't watch him. Well, that old man was the same guy who was having an affair with his wife, because she would shave him, she would brush his teeth, she would comb his hair, and he didn't like that one bit. The other thing with the mirror, with the living room where he got angry about all the people, we then recognized that it was because their reflections, the two of them, were bouncing off of all of the windows. So if a person with dementia is talking about some aspect of their reality that doesn't seem to make sense to you, yes, you definitely want to discuss it with their healthcare provider, but you also want to pause and ask yourself what's going on. And from an auditory perspective, we can imagine that if I am in a hotel room, for instance, with my sweet one, and the refrigerator compressor goes off in the middle of the night, and he wakes up and he starts yelling about there being somebody in the room with a leaf blower, for instance. I don't want to just say, for crying out loud, it's the refrigerator, it's not a leaf blower. What I want to do instead is say, wow, you know what, that's really loud and disturbing. And I can see why you thought it was a leaf blower. I thought it was a leaf blower, but you know what I figured out? It's the compressor. Wow, okay. So being thoughtful about corrections. Procedural memory issues. So these are common in most dementias. And the reason I show the picture of this little guy with a toothbrush is just to make the point that some of the things that we do on a day-to-day basis that are just part of, like, they're just, we don't think of them as big deals at all, are actually pretty big deals with lots of steps. So for instance, brushing the teeth. When I teach dementia classes, I have everybody take out a piece of paper and write down the numbered steps that are involved in brushing the teeth. And some people will come up with 2 steps, right? Put toothpaste on the toothbrush and brush your teeth, like there you go. Some people will have 9 steps. Some people will have 15 steps. So if the first step is put the toothpaste on the toothbrush, okay, but what about finding the toothpaste? What about taking the cap off of the toothpaste? What about finding the bathroom? So for a person who is living with dementia, the steps in a sequence can go away. And so therefore, when we give what we think is a very simple instruction, like, would you please take out the trash? There's a lot that goes on there. You have to take it out of the can. You have to make sure that it's wrapped up tightly. You have to go out to where the trash can is. You have to open the lid. You have to put it in. And so as care partners, we need to just gather some patience around the idea that maybe things are going to require a lot more instruction than they previously did. And maybe what that means is that we just give one little step at a time and we allow people to be successful. If the instruction is, can you please take the bag out of the trash can, the person is more likely to be successful. We can celebrate that success. And now I can say, can you please take it out to the garage? And then I can say, can you open the lid and put it in? And I realize it's a lot of work, but it also saves dignity, preserves dignity, and creates less stress. So how do I support procedural memory changes? So I want to introduce you to this concept called cognitive ramps. And this is something that I learned about from another one of my dementia heroes, a fellow by the name of Dr. Alan Power. He has a great book called Dementia Beyond Drugs, and Dementia Beyond Disease is another one of his books. But anyway, I had the great fortune of hearing him speak. I'm in Seattle, and he was speaking here a few years ago. And so the idea of cognitive ramps is creating opportunities for people to be successful. So he did in his lecture, he gave this great description. He said, imagine that here I am in an auditorium with all of you, and I share with you the fabulous news that I have somebody joining us today, a colleague of mine who's coming all the way from South Africa to share some amazing findings about dementia. And oh my gosh, here he is. And so Dr. Power says, imagine at the back of the room that a door opens and in comes my colleague from South Africa who has just flown in, and he's in a wheelchair, and he rolls his wheelchair down to the foot of the stage, and he looks up at me because he's supposed to be with me on stage, and he looks at the stairs, and then he looks at me, and I realize, oh my God, he needed a ramp. In order for him to do the thing that he needed to do, he needed a ramp to get up here. And now he can't be successful because me, the one who had the strong arms and the capacity to put a ramp there, didn't do it. So cognitive ramps are the idea of me preemptively recognizing where the person I support is probably going to have some issues, and I want to set them up for success. So an example of this, if I tap into my mom again, she called me one day and she said, oh, for crying out loud, Ken was making the coffee today, and instead of putting the water into the coffee machine, he put the cream right into the coffee machine. I'm sure it's ruined. Well, that's it. He's done. He no longer gets to make the coffee. So let's just focus for a second on routine. Routine is really important for a person who's living with dementia. It makes everybody's lives a lot easier if we know that certain things happen at certain times of the day, and that we include in that routine things that make them successful. So Ken's routine for years and years and years was that he would get up in the morning. First thing, he would make the coffee. Why? Because he loves my mother and she loves her coffee. And when she wakes up, he wants the coffee to be ready for her. Then he would grab the newspaper from the side door. He would sit down, turn on the TV, and while the news is playing on the TV, he would be reading the newspaper, happily listening to the coffee create itself in the coffee machine. So I shared this with my mom. I said, this is his routine, Mom. It's what he does every day. So when you take away making the coffee, how is that going to feel for him? It's going to completely disrupt his flow. So what we need to do is create a way for him to keep doing his routine, which means he needs our assistance to be successful. And so how do we do that? We turn the thing into bite-sized steps. So maybe what we do is we put a list out that says, number one, put water in the machine. Number two, whatever it is. Or maybe what we do is we actually have a little pitcher of water sitting next to the coffee machine, and we put a little label on it that says water. Many people, even with advanced stages of dementia, are still able to read. The problem is reading a book, especially if they have a memory impairment, because by the time I get to the end of the sentence, I don't remember what was at the beginning of the sentence. And so it can be extremely frustrating for people to read. However, little words and labels, people can still read those. Or I can use icons, right? I can use little pictures. So I'm going to slow down, use things like lists and labels. Impulse control and appropriateness. So doing and saying things that are not in keeping with normative standards. So my rule is safety first. We need to make sure that people are not going to do something that gets themselves or others in trouble. But as much as possible, I want people to be able to do things the way that they want to do them. But sometimes they might do things that are incredibly embarrassing for me. And so how do I deal with all of that? So if the thing that my mom wants to do is wear 3 sweaters, she comes downstairs and she's got 3 sweaters on, I am not going to argue with her and say, for crying out loud, it's 78 degrees outside, you don't need 3 sweaters. What I might say is, wow, look at you. You look beautiful. Let's go. And I know that when we get outside, she's going to get hot and we're going to start peeling off sweaters. I could offer something like, I could say, you know, I wonder if you actually need all of those sweaters. But what I'm doing then is I am reminding her that she's ineffective and that she's not good at what she does. She can't even get dressed anymore. And so I want to avoid making her feel bad about herself. but sometimes the thing that somebody is doing is going to cause problems when they get outside. So for instance, if rather than having 3 sweaters on, she had her brassiere on the outside of her shirt, which is something that is not uncommon, or underpants on the outside of pants. In that case, I know that it's going to be an issue when we leave the house, because that's just not appropriate. It's not something that people do. And so in that case, I would make a suggestion. I would say something like, you know what, I love what you've got on there, but I'm thinking that maybe if we just put this one on the inside, that maybe that would be helpful. And I might lift up my own shirt and say, see, I have mine on the inside, so let's put yours on the inside. I was at an outdoor movie venue with my kids. So my kids were just 12 and 15 when my husband was diagnosed. And we went to an outdoor movie at a big park, family park. It's like a Disney movie playing. It's all very like people are in their chairs, eating picnics, watching the movie. And my son leaned over to me and he said, "Oh God, Mom." And I looked over at my husband, and my husband was masturbating in public at a family venue, right? So I can't be like, well, but he's got dementia, he does that kind of thing. Like, nope, not appropriate. So how do I deal with it? In this case, I threw a blanket over him. I took his hand and I said, I think that it might be better if you hold my hand instead, because this isn't the right place for that. So we do need to correct to make sure that the person isn't going to get themselves and others in trouble. But I guess the message is we need to choose our battles. So how do I appropriately deal with things? Deep breath. Do my best not to shame someone. Like, what you're doing is disgusting. That's ridiculous. It's not their choice. They wouldn't be doing this if they were a healthy person. And so I don't want it to be about them. It's not about them. It's about the disease. So we can change the situation, but we can't change the person. This is one of the things that we can't change. It's because of what's going on. So how do these changes in the way that a person exists in the world when they have dementia affect their lived experience? Well, as you can imagine, there's a video that I watched that I have seen many times that is about an experience that people can do where you actually like get to feel what it feels like to have dementia, where you put on these goggles and you put things in your ears and you have stuff in your shoes, so everything makes you a little bit uncomfortable. And that can perhaps give you a sense of it. But just from what I have seen, supporting my husband, supporting families, volunteering in many communities. My husband lived in 5 different communities, so spending time in all of those communities. What I've seen is that it's really hard and that it's really scary. And for a lot of people who are living with dementia, the world is a confusing place. And the world is a place where they don't feel so good about themselves and where they don't understand what's going on. And so what I want to do is communicate with them in ways that respect their dignity, that cause them to feel soothed rather than feeling attacked. And so that's what I want to talk about a little bit now. So number 1, reflect and validate emotions. So one of the things that was really challenging for my husband is that he still wanted to use his gadgets. He still wanted to use his phone. He still wanted to use his computer. He'd been a software engineer for years. This guy knew technology, but it didn't work anymore. And so he would freak out when he was starting to use his phone and he couldn't get it to work, and he'd be screaming and shaking his fist because it doesn't work, it doesn't work. I didn't know any better. I met him where he was. Well, maybe you should just put it down. And I'd get agitated and angry, and my God, it never went anywhere good. What I wish I had done is said, wow, the phone is not working the way that it should be working. So I am reflecting his experience. And now I'm going to validate his emotion, which is to say, you are so angry and you should be. I would be angry too. It's so irritating that this doesn't do the thing that you want to do. Oh, come here, come here, come here. And I would pull him into a hug rather than getting into the same emotional state that he's in. So not calm down. You need to just calm down right now, because nobody is going to calm down just because you ask them to. And let me help you or let me do it for you is basically just saying, you suck. You can't do this anymore. So I'm going to do it for you instead. I could say, how can I help you? I could say, maybe we could do it together. I could find ways to offer assistance that have us be a team rather than having me be the one who's better than he is. Definitely using non-blaming language. I can't believe that you did this. This is all because of you. Whatever it is, no, I want to avoid that, because again, remembering it's not the person, it's what is behind it, which is the disease. Certainly offering comfort and reassurance. I'm so sad for you. I'm so sorry that this is happening. I'm sorry that you feel this way, and how can I hold you? How can I help you? Checking my own emotional state. Oh boy, we always need to start with that, checking my own emotional state. There is a process that we go through in the classes that I teach about helping when behaviors are when somebody's reactions to the world are challenging. And the first step is always just stop. Just stop, take a breath. We think about the fact that those people who show up at our door when we dial 911 are not called first reactors, they're called first responders. And there's a big difference between reacting and responding to a situation. And the big difference is that with response, we pull out the emotion. And so when I'm supporting a person with dementia, I want to be a responder, not a reactor. Respecting their reality, that's not my job to correct them. Boy, how many doctors have I been in a room with where I have had to say, you know what, could you address my husband with that question? Because he's actually the patient. And especially when he was nonverbal and people would talk to me instead of him, even the diagnosing doctor, instead of looking at my husband and saying, sir, or Evan, you know, I'm so sorry, but this is what's going on with you. He looked at me and he said, your husband has something called Pick's disease. And like right at the outset, our first experience was that when people think you have dementia, they stop treating you like when people know you have dementia, they stop treating you like a person. They treat you as less than. As I mentioned, my husband was a software engineer. And when he could no longer work as a software engineer, we got him a job at our local fish hatchery, where his job was to feed the fish. And it was something that gave him meaning. It was something that he could do. He eventually quit that job. And the reason that he quit is he said, I don't like it anymore because people treat me like I'm stupid. Why do they treat him like he's stupid? Because he's slow. It takes him time to respond. It takes him time to ask the right questions. His affect is different. You know, maybe his jaw is a little slack now. Maybe he doesn't look like he's focusing, but my God, there is a person in there who needs to be treated like a person. Don't argue. Avoid logic and reasoning. So, you know, if we're heading out and I say, wow, you're wearing that because it's 25 degrees out and he's wearing a t-shirt and shorts. Wow, you're wearing that. Yes, I'm wearing that. As soon as I've said that, I've already set up for failure, right? Because I have made the assertion that there is something wrong with what he's wearing. I can say, you know, I'm going to be wearing a coat because I did look at the temperature, and did you know it's 25 degrees outside? I can offer that kind of thing. But for me to say, you know what, you need a coat. Those words, telling somebody what they need to do and what they should do, I don't know about you, but I don't have dementia as far as I know. And when somebody tells me what I need to do or what I should do, boy, do I feel the little hairs on the back of my neck raise up. I am ready to fight. So what I do instead is I say, okay, you know, I made my suggestion that maybe a coat would be a good idea. And then I make sure that I have his coat tucked in my bag so that when he gets cold, I have a coat for him. So the one who needs to change behaviors is actually the one with a healthy brain. Respecting apathy. Your doctor said that you need to walk. Why are you sitting down again? You really need to get up and walk. A common affect of people who are living with dementia is apathy. They don't so much want to do the thing that they used to do. And so or the thing that they're supposed to do. Maybe they shouldn't be eating so much. But I have to accept the fact that there is a disease at play here, and that my nagging, if it's just causing friction in the relationship, is not worth it. So any of the negative health effects of not walking or of eating things that he's not supposed to eat are probably not as damaging as the negative social interaction. And so therefore I really encourage people, again, choose your battles. focusing on encouragement and really emphasizing what is it that they can still do. And let's do that. Let's do that well. And let him continue to do that as well as he can, like with Ken and the coffee. So one of the ladies in my support group just this past week said that it was a really hard week for her. And she said, because Bob woke up the other morning and we were sitting down having coffee and he just looked so sad. And I said, what's going on? And he said, I'm useless. He said, there's nothing I can do anymore. And I am of no value. And so we talked about, as a group, we talked about, so what, then what, you know, how do you support a person? And what we landed on was looking for the things that are valuable. Like, are you kidding me? Oh my God. Do you know how sad your grandchildren would be if they didn't get to see you? Do you know how sad I would be? Look at us, we're having coffee together. My morning would be ruined if I did not get to have coffee with you in the morning. It's because of you that I smile every day. Finding reasons to remind the person that they still matter and that they're still important. So a third of the people in this room on this call are likely to experience cognitive changes. It's like sad fact. Like the greatest predictor of whether or not you're going to get dementia next year is your age, right? So if you're 65, it's like a 5 to 7% chance that you might become symptomatic with dementia. By the time you're 85, it's about 35 to 40% chance that you'll have dementia. Important takeaway is that dementia is not a part of normal aging, and that many people, that more people will not have dementia than do have dementia. I think that it's also good to remember that doctors reckon that right now, probably 30 to 40% of people who have a dementia diagnosis have something that was preventable. So therefore, it's really important to also understand, and that can be a topic for a future lecture, but to talk about what are the things that we can do to preserve our healthy brains and to stay as healthy as possible ourselves, both in our role as caregivers and just as people who would rather not get dementia one day. Thanks for coming, everybody. Have a great day.